Have you ever thought that just because you have a family history of arthritis or because you're getting older, that you're destined to have arthritis too, and that there's nothing you can do about it either before, during, or after? We're going to dive into that misconception right now. Welcome to Back Talk with Dr. Ryan. I'm Dr. Ryan Wolfer, and on each episode, I address the most common questions and misconceptions about back pain and spinal health and help you strengthen your spine so you can BYOG, be your own guarantee for your health in your life. And today, we're going to talk about arthritis, specifically osteoarthritis. Now, osteoarthritis, and I might refer to it as OA for short, osteoarthritis, and it's a very common form of arthritis, and it's often called degenerative joint disease, or even in the spine, degenerative disc disease, and it's the wear and tear arthritis. And basically what that means is there's cartilage that is in between the bones that helps to lubricate and cushion the bone against each other where the bones connect. That's the joint. And with OA, osteoarthritis and degeneration, that cartilage breaks down and it can cause pain, can cause stiffness, can cause lack of mobility. And a lot of people, and you probably have even heard this, that it's because you're aging. It's a normal part of aging. It is and it isn't. And there's things that we do that can either accelerate it or slow it down and even prevent it in the first place and reverse it. And these are lifestyle factors. And if it was just due to age, then every single joint of your body would have the same level of degeneration at the same time, because in general, every joint that you have, unless you've had it replaced, is the same age as any other joint. So that hopefully puts an image of, okay, you can do this. You can prevent it. You can slow it down. You can even reverse it by using different lifestyle factors. And what are the ones that we're talking about? Well, number one, there's your diet and nutrition. That has a huge role in your joint health, because whatever you're putting into your body is either building up the joints and that cartilage and the bones and the disc, or it can tear it down. So we want to make sure we're eating anti-inflammatory foods, organic products as much as possible. Organic produce, a good reference or resource is the Clean 15 and the Dirty Dozen, published by the EWG every year, ewg.org. And that gives you the Clean 15 are the vegetables in produce that if you had to choose ones that weren't organic, then choose those. The Dirty Dozen are the 12 that are most sprayed by pesticides and herbicides that you want to stay away from. And you want to, if you're going to eat those, then eat them organic. So organic, you want grass-fed, 100% grass-fed, grass-finished, free-range, pasture-raised, protein sources. You want wild-caught if you're eating fish, whether it's salmon or sardines, mackerel. So those are the things that you want to load your body up with. And you want to avoid things like highly processed, or just in general processed, refined foods, carbs, sugar, gluten, in wheat products. Because these, if you eat too much of those, and if it's a staple of your diet with breads and pastas made of wheat and gluten, and even cookies and I said breads, but those types of processed refined carbs damage your joints, causes more inflammation. So we want to reduce the inflammation, reduce the breakdown, lift up and include the raw materials that strengthen the spine. Obviously, we want healthy fats. We want to avoid processed, refined vegetable oils. We want to avoid cottonseed, safflower, sunflower type oils. Those are the ones that are commonly in those processed type foods. We want to avoid ultra processed and processed dairy and cheese, and we don't want that as a staple of our diet, because it just increases the inflammation of your body. Now, if you want just a list of foods, I created a Strong Spine food list to help be your own guarantee for your diet. And it's listed in 5 basically levels. And you want to stick to the top 2 levels. So if you want that list, I can provide that for you. Just type in list in the comments and I'll make sure that you get that. Now, along the same lines of diet, nutrition, and what we put in our mouth is the supplements. The supplements that we take to help, think about it like it's the maintenance program, all right, for your car. Or even, the car is a good example, is we want to help maintain it. We don't want to just rely on supplements. We want a healthy whole food diet and nutrition plan. But a lot of times to help rebuild the cartilage, rebuild and keep it healthy, we want the supplements, especially because the age that we live in, where it's hard to get all of our nutrients just from the foods that we eat. So things like glucosamine sulfate, MSM, collagen sources, a nice collagen peptides, curcumin, which is an active ingredient in turmeric. So those are great to support joint health and reduce inflammation. And they're the building blocks, and to provide more building blocks and provide the maintenance, like I said, for the cartilage. Now, again, I want to make sure you have the resources with this. So if you want, I created another resource. It's called 20 Years Younger: How to Eliminate the Aches and Pains Associated with these joint issues that we have without harmful drug side effects. Again, you can have that too. I'll just type in 20 in the comments, and I'll make sure I send that to you. And just forewarning, I have other guides I'm going to recommend for you. These are completely free. You don't have to pay anything for them. The next lifestyle factor, the next lifestyle aspect we want to take care of is our exercise, our mobility. There's different types of exercise that we can do and should do to make sure our joints, and especially the joints of our spine, stay healthy. Low impact cardio, improve circulation, can strengthen the muscles too, but I really like it for increasing circulation throughout the body. Mobility exercises. So mobility is a little different than flexibility. With mobility, you're controlling the joint range of motion through its maximum range of motion. So it's not just holding a stretch for a period of time, which again, that is important as well. But I like mobility because it helps to maintain strength and flexibility at the same time through that range of motion. And strength training is so important because that load that we get on our joints and our spine and our discs also helps to increase circulation in the joints, and also obviously helps strengthen the muscle. So I got another guide for you. Again, you can have it, no problem. It's the ideal exercise prescription for a healthy 100 years. Just type in MOVE. I won't make you type in strength. Just type in MOVE, MOVE, and I will get that to you. Make sure that you get that. What's another lifestyle factor? And I'll lump these together. Your stress and your sleep. We want to, we hear it a lot, or at least I think you do, is the stress, meditation or relaxation techniques, breathing. So many times we just hold our breath and we don't even realize we're doing that. And we want to bring awareness to the breath in times of not just when you're stressed, but outside of these stressful times, because that will help oxygen flow throughout the body. And when we are focused on our breath and breathing light and slow and deep into our diaphragm and not breathing through our chest, that's when we're in a relaxed state. And we want to practice that when we're not stressed. So then we're training ourselves in times of stress to automatically go in that way. It's simple, consistent methods like this that help you in times where, all right, we just need to clear the mind, okay, focus the mind. All right, so just light, slow, and deep breathing. When you breathe, you shouldn't see it. It should be that light, it should be slow, and in the diaphragm, not the chest. So that's a great relaxation or stress relieving method that we can do for our lifestyle. Sleep. So sleep is where our body gets to repair itself, from the brain to the spine to the cartilage, the bones. That's where we repair the the injuries and the stress that we've been placing on it physically, chemically, emotionally during our day. So if you're not getting good quality or quantity sleep, then your body is not going to repair. Your joints are not going to have the chance to repair. So I got a sleep guide, a sleep checklist, actually, just where you can check off different various aspects to make sure that you're getting the right quality and quantity of sleep. Guess what you got to do? Just type in sleep in the comments. And why am I doing all these different guys rather than just one? Well, you might be at a different phase than somebody else. Somebody might need more help with their nutrition, whereas you might need more help with your sleep, whereas your husband or spouse or wife or whoever might need more help with their movement, with their exercise. So that's why I wanted to make sure you can have all these. All right. So another lifestyle factor, and this is one of my specialties, obviously, because this is a back talk is about improving your back pain, spinal health, strengthening your spine. And a big part of that is making sure your spinal posture is strong, that your spinal positioning, the body mechanics and how you move, because how your posture is, whether we're standing up, sitting down, bending, lifting, lunging or sleep, even our sleep posture, that is going to lead to, especially if it's in an unhealthy way, lead to stress and misalignments in your spine, increasing more stress. So think about your spine, your joints, like the tires on a car. If the alignment is off in a car, right, then it's going to pull to one side. That misalignment, that poor alignment, is going to cause more wear and tear and on those tires and increase the progression of that wear and tear. But with good alignment, with proper alignment, that stress is off the tires and it's nice and even. So that's where we want to distribute the load evenly. That's why great spinal posture is so important. And guess what? If you want the spinal hygiene mini class that goes over these 4 aspects of the Eaton method, EATN, exercise, adjust your lifestyle, traction, and then nutrition, go ahead, type in spine and I'll make sure that you get that. Because the connection, between the poor posture and osteoarthritis is so prevalent, especially when we're talking about the low back and hips. So we want to make sure we identify and address that. Now, a good question that I get asked a lot is, can we reverse arthritis? Can we, increase the cartilage? Can we rebuild the cartilage? Because oftentimes we've been told, and I don't want to say I guarantee it, but I'm confident that you've been told and think there's nothing that you can do about it. Well, I can say for sure this: if you keep doing the same thing, the same lifestyle, or having the same lifestyle with your diet, nutrition, exercise, your posture and body mechanics, your sleep, the stress building up mentally, if you keep having those same things that caused it in the first place, then it's not going to get better. You can't reverse it. But if you use these things in the guides and the checklists that I've made available to you, then you can improve it. It might not 100% go completely away, but you can improve it. You can improve those things. So it's not about just your genetics or because your family had it, your parents had it or have it. It's not because you're getting older. Hopefully we dispelled that misconception today. So having a holistic approach of your food, your fitness, your mindset, your sleep, your posture and function and body mechanics, that can help you be your own guarantee for your arthritis, and then help prevent, help to avoid, help to slow down and even reverse the effects and reverse that breakdown of that arthritis and the joints. So hope you enjoyed that. And definitely comment below if you want one of those guides, or if you want all of them, type in all, and I'll make sure I'll try to send you all of those. Not try to, I will. And comment below if you haven't subscribed yet. Make sure you subscribe to this channel so you don't miss an episode. And what I'm going to do is I'm actually going to take a sip. I'm going to take a sip, and we're going to go into another common. Let me take a sip. Another common misconception, because I like doing 2 at a time, 2 each episode. I see Tanya. Let me address this here. Interested in receiving all the guides you mentioned? Excellent. Good. All right. All right. This is going to take a second. But Tanya, make sure that when I post this, if you can also, hey, Meredith, if you can also type in all, and actually what I'll do is in the description, that's what I'm going to do. In the description for this, I'm going to put all these guides. Okay. Make it nice and simple. How's that sound? Good? Good. If you have back pain and leg pain along with it, or neck pain and arm pain, or maybe you just have leg pain or arm pain, do you have a slip disc? Do you have a bulging disc, a herniated disc? You know, these terms get tossed around a lot, especially when we have extremity type pain, numbness, tingling. But what do they really mean? And more importantly, how do you know what's going on and if that's what's the problem in your spine? So that's what we're going to talk about now at this part, okay? So let's address this. It's, again, a very common question and misconception about back pain, about spinal health, because we want to address this so we can strengthen it, identify and strengthen, identify the issue so we can strengthen the spine. And of course, what's the lesson? Be your own guarantee, BYOG for your health in your life. So I want to go back to a little anatomy of the spine, because the spine is made up of bones. So those are called the vertebrae. And in between the bones are these discs. They're the intervertebral discs or spinal discs. I'll just say discs because it's easier than saying the whole long thing. So what these are like are, envision a jelly-filled donut, only these are a lot tougher. They're a lot stronger. So the outer layer, it's known as the annulus fibrosus. And on the inside, so that's the donut part. And on the inside, the jelly-like substance, that's called the nucleus pulposus. I don't expect you to remember all of this, but I just wanted to make sure you understood how and what the spine looks like there and what the discs actually look like. And with these discs, it allows your body and spine to move freely. It allows your spine to absorb more stress, absorb more shock. It creates the space between to where the nerve comes out of the hole. It's called the foramen, between where so we got the bones here, all right, the vertebrae, then right here is the disc. And in between those, the connection between the bones and the disc, and even the back part of the spine, the vertebrae, is where the nerve comes out. So now if there's not as much space because there's something wrong with the disc and it's encroaching on that space, well, now that can create the arm pain, the leg pain, or wherever you're feeling that, because the nerves go down the legs from the low back. They go down the arms from the upper back and the neck. So it just depends on where it's coming from. So that's why these discs and healthy discs, hydrated discs, are so important for the spine, and we want to make sure we limit the breakdown of them. So how does the damage happen? Well, different physical stresses that we place on our body, emotional stresses, chemical stresses, they can injure the joint, essentially can wear it down. And that can be a gradual thing. And typically it is, like the quote, can wear and tear and cause cracks in the disc, or it can be done suddenly. And it very often I hear and this is a question that I addressed in a previous video. Make sure you check that out. I'll make sure you have a link called Hidden Causes of Back Pain, about why we have back pain and why some days we have it or we don't have it one day and then we do the next day. So make sure you check that out. But essentially, we don't have to lift 1,000 pounds one time for us to have a back pain, or a lot of times the back pain happen and even damage and injuries to the disc is us having these lifestyle issues where it's causing stress over and over and over again, where it's lifting a pound 1,000 times and it leads to breakdown. But so you can either have an acute episode where you do lift too heavy of a weight or too heavy of an object, and then your back goes out. It doesn't happen as often as the wear and tear aspect of it, the gradual weakening of the spine. And I want to address this because it's a common term, and it might even be more common than bulge or herniated that people have, is that people ask is or mention. They say, I have a slip disc. Well, slip disc is a slang term, so I guess they're halfway right if they know they had a bulge or a herniation, because it essentially means, yes, you have a bulge or a herniation, but there's a difference between those two, which I'll explain in a second, that's irritating the nerve. So very rarely does a complete slip of the disc. So remember, we got the bones, the vertebrae, and the disc in between, and it covers that entire thing. It's not like the disc slips out between it. But what can happen, the most common things that can happen with that are three things. It can become degenerated, bulged, or herniated. So I'll explain each of those just quickly right here. So with a degenerated disc, it loses the moisture. And you can think about that as the start of arthritis. And when you have symptoms, that's when we call it arthritis or arthritis flare-up. When there's no symptoms, no pain, then it's degeneration is the typical term. So it loses its hydration, it decreases in size or it gets narrowed, it shrinks, and there's some cracking of the disc. So compare it to like a dried up sponge. So just like a dried up sponge does not have the elasticity of a fully functioning sponge, and it's easier for it to crack and to become broken. It's the same thing with the spine, and typically with a spinal disc or with degeneration. And the typical symptoms in general, again, there's overlapping symptoms with each of these, or it can overlap, but it tends to be more of a dull ache, maybe occasional sharp pains if you move incorrectly, or if you might wake up a little bit more stiff. That is more of a degenerated disc. Now with a bulging disc, so let's go back to the jelly donut analogy. So you have the outer tough layer of the disc, which is the donut. You have the inner gel-like substance, which is the nucleus pulposus in the disc. So with a bulging disc, so now the cracks in that outer layer are enough, that are injured enough, well, the inner gel starts pushing out on that annulus fibrosus. So remember, that's that outer layer. So when that happens, it can push, it's still intact, but it pushes part of that donut layer into a nerve, into the hole, and can cause dull radiating pain down the leg, down the arm. Again, it just depends on where that bulging disc is in the spine and can irritate the nerves. And it occurs pretty common. And you can probably, I'm not even going to be wishy-washy with that. Many times you have a bulging disc without any symptoms. There's been studies done showing MRIs, and they've done MRIs of people with no low back pain, and I believe it's 60% of them have a bulging disc. So just because you have a bulging disc doesn't mean you have pain, but that doesn't mean there's not a problem. All right. Just like, let's take blood pressure. You don't feel high blood pressure, but that doesn't mean it's okay. All right. You might have high blood sugar. You might not feel it, but that doesn't mean it's healthy. It's the same thing with a bulging disc, because what can happen is if you continue to stress the disc, stress the spine over and over and over again with the lifestyle factors, with poor posture, with poor diet, not eating enough healthy foods, if you're not getting the right amount of sleep, if you're mentally stressed, if you're sitting too much, bending incorrectly, and your body tries to compensate for that, it continues to wear down the disc. Now, let's go back to the slipped. So remember, slipped also means bulging and herniated. So it's both of those. Now, does that mean spondylosis? Somebody asked. So spondylosis actually is more degeneration. Spondylosis is degenerative joint disease. So that can also decrease the space where the nerve comes out. So slipped has to do with the discs, where spondylosis, yes, if we're talking about degeneration and that like arthritis, that's more of the spondylosis. So the last one I want to address here is the herniation. So this is I want to say the end point, because it could be the starting point for some disc if it just completely, quote unquote, blows out. So this is where that jelly seeps out, where that outer layer is completely, it's injured to a point to where now the outer layers can't hold in that jelly-like substance. And remember, there's chemicals in there, healthy chemicals, but you know what I mean. Hopefully you know what I mean, that jelly-type substance, that nucleus pulposus, and now it's more of a chemical reaction, chemical irritation of the nerves. And a lot of times you get sharp, intense pain, tingling, numbness, possible weakness, because the nerves are so fragile. That's why we have the spine protecting them. That's why, the brain is so fragile. That's why we have the skull to protect it in bone. The spinal cord is so fragile. It's a nervous system. That's why we have the spine protecting it. So when it gets irritated and it injures the nerve, well, now it takes longer for that nerve to heal. So with that, that's why we want to make sure you get the right therapy. You want to make sure that you get the right diagnosis or plan of action with that. Now, I mentioned you can have overlapping symptoms, right? You can have pain and tingling and numbness in all of these cases. It's just whether it's degenerated, whether it's bulged, whether it's herniated, they have, telltale signs or more common signs with that. Now, with these, again, I'm talking in generalities here, there are different treatment approaches with them, but it just depends on your case. And yes, it can be complicated. So that's why, I try to provide images here and analogies for that, because it's simple in the fact that, well, how do we address these with our lifestyle, right? The lifestyle that we have with our nutrition, with our sleep, with our mindset, with our posture and spinal health. So yes, it can get complicated. I don't want to make it complicated though, because I like to make things simple. And that's why I do these. And I want to make sure you hear these over and over again. I repeat myself, because that's where it can start to become uncomplicated. And somebody had asked about bone spurs. Let me address that right now. Bone spurs are the result of the breakdown. Bone spurs happen as a result of the disc breaking down, of the increased wear and tear, and the reaction that gets placed on the bone. So with bones, when they're stressed because of the breakdown of the cartilage, it forms new bone to try to almost fuse and stabilize. So you get these bone spurs coming out, whether it's on your spine, whether it's on your ankles, your knees, your hips, in your hands, hand arthritis. You can get these nodules in the bones because the cushioning isn't there anymore. So now it increases the stress on the bone, creates new bone, and that's what a bone spur actually is. So the different treatment approaches, depending on what type of problem that you have with the disc. If it's degeneration, exercise, nutrition, posture and lifestyle changes are especially important. And, we talked about that in a previous video, right? Previously, is what arthritis is, that degeneration, how to improve that lifestyle. So again, I'll make sure that you get a link to that video or go back and watch the previous one that we did on back talk. Bulging disc. So this is a good spot for corrective chiropractic care, and the technique that I love, and even spinal decompression, which helps take the stress and creates a gentle stretch and more separation and space for the nerve to come out and allow the disc to heal. And then, so that's decompression and corrective chiropractic care. Again, what I use is called chiropractic biophysics. They're the leaders in the research in this technique, and also spinal health and how we can take stress off of your spine so you can strengthen it and make sure it doesn't break down, or it definitely slows the breakdown. We want the whole body approach, and that's what we do with CBP. Now, with herniations, we want to try conservative care first, whether that's physical therapy, chiropractic biophysics, exercises, nutrition. They're always going to play a role. Lifestyle factors are always going to play a role with each of these. It doesn't, I'm breaking it down into degeneration versus bulged versus herniation, but we always want to try conservatively first. But with a herniation, a lot of times that does require surgery. I know in our office, and over the last 24 plus years of me doing this and being in practice, if conservative care doesn't work, there are signs where if spinal decompression does not feel good while you're in it, or even after a few visits, if it doesn't feel good, then we know, okay, that's probably a herniation, and they're a candidate for surgery. So those types of signs to let us know that. And I'm not sure if that's happened to you, but that's those types of signs and symptoms that you can pay attention to. All right, take a sip here. All right, so last thing I just want to mention, if you want the spinal hygiene mini class that touches on and explains how to take as much stress off of your spine and your discs as possible, type in spine in the comments and I'll make sure I get that to you. And then I'll also, again, I'll put these links in the description as well. All right, sound good? All right, good. Very good, everybody. Thanks for joining me. Hopefully, let me see. I think I got bone spurs, spondylosis. Answered those questions. Good. Hopefully I answered those. If you need more verification, I'm gonna post this, and definitely for everybody commenting in the chat, look in the description that I'm going to be posting, and when I goes live, or actually it's in the description now, you can download the spinal hygiene mini class. I actually have to get the other ones in there, so bear with me and I will get that to you. Thanks for joining me. Bye-bye.